Hello, my name is Anthony Hurley and I'm going to be doing Foley catheter insertion. So here we go. Knock, walk into the room. Hi Hines, my name's Anthony. Wash my hands. I'm going to be your nurse today, and today I'm going to be inserting a Foley catheter. As a side note, some of the procedures I'm going to be doing, such as sterile field and other things of that nature, I'm going to be vocalizing more so than doing, just because it's hard to do it outside of a place where you have all the facilities like in lab. So without further ado, I'll get to it. So I said hi to Hines. I'm telling him that I'm going to be inserting a Foley catheter on you today because you're having some urinary retention and your provider has ordered this for you. And before coming in here, I verified that this order is in Hines's chart from the provider. And so it's going to take 10 minutes. What I'm going to do is I'm going to stick this rubber tube up your urethra and inflate in a balloon, and it's going to help us to drain the fluid from inside your bladder, okay? If you feel any pain or have any questions, please let me know and I'll be happy to answer them or do the best I can to correct the pain. So can you tell me your name and date of birth, please? And he tells me Hines Ward, March 8th, 1976. And he says no allergies. And I say, all right, that's good. So then I pull the privacy curtain. Okay, I'm gonna raise the bed to a comfortable working height and lower the side rail, and the bed is flat right now because it's easy to work. So I've washed my hands and I would put on a pair of gloves, just gloves here, regular gloves. And so then now here's the bed, and then here's kind of just a side table. That's what we'll imagine it as. So I've got the kit. And the normal kit you peel off in like 3 layers, so like it'd be like 1 layer, 2, and let's just say 3. And now I've got, this would fold down in a normal kit. Now let's just say that I have my gloves on, and now I got this drape, and I'm gonna remove Hines's blanket. Which it's hard to tell. Here it is. So I'm going to remove Hines's blanket and I'm going to put him in frog leg position. So he's in frog leg position with his knees bent, and I'd slide this up underneath his butt so that anything that drips down will be caught and it won't stain his bed. Okay, and I still have my gloves on, and I'm going to take 3 of these towelettes and I'm going to grasp the penis and clean from the urethra down with all 3 of these 3 times in a row, same motion, and then I'll discard. And then I'd remove my gloves, and then I'd put hand sanitizer on my hands. I'd wash my hands before proceeding, and then I would pull this last curtain or whatever it's called, and now I got my sterile gloves, and now I'm going to be facing my sterile field still. So then pull this open. In the normal sterile field, I can't drop my hands below my waist, but for this, I kind of have to because this ping pong table doesn't raise. So now I'm going to grasp the inside of the cuff. Come on, hands. And I'm going to reach for the stars. Now I'm going to take this other hand and go underneath this lip here. And then reach this hand in and then reach for the stars. Okay, now both of these hands are in and above, and now I'm going to grab this sterile drape or whatever you want to call it, and it's going to go over Hines's body, and his penis is going to go through that hole. So I'll readjust the drape from the inside because it's sterile, and right in this hole is where Hines's penis would be. Okay, so now I'm gonna come back to my field and I'm going to set this up here. So what I'm gonna do is I'm gonna move this here, and I'm gonna rip this pack and place these 3 iodine swabs in there and drop. And then I've got sterile lubricant, and I'll put that in the kit here. I'm gonna use that to lubricate my catheter, and now I've got this water plunger that I'm going to put on the catheter once I get this out, but first I'm gonna be careful to protect the tip when I'm removing this. So I've got the tip, and I'm going to put it in the lubricant. Okay, and I'm gonna tuck it back in, and then I'm going to take this air, or this balloon port, and I'm gonna note the amount of volume in the syringe so that I know how much has been injected into the balloon. And I've noted the size of the catheter and the size of the balloon. Okay, and now with that set up, I'm now ready to transfer over to the client's bed. So I'm on the side table now, I'm gonna transfer over to the bed. So maintaining sterile field, going to pick up this kit, and I'm going to drop it in between Heinz's legs. Okay, and this wouldn't have poked out in real life. Okay, so now what I'm going to do, I'm going to grasp Heinz's penis, and I'm going to do the same swab technique that I did with the earlier wipes. I'm going to go around the urethra, down the tip, and drop. Around the urethra, down the tip, and drop. Around the urethra, down the base, and drop. Okay, and now I'm gonna grab this, and I'm gonna note that the tip's intact and it's already lubricated. So now I'm gonna have Heinz take a deep breath and bear down like he's trying to go to the bathroom. So on count of 3, Heinz do that. 1, 2, 3, and I'm inserting until I see a flash of urine. I see a flash of urine, 1 to 2 more inches, and then I'm going to grab here and inflate the balloon. Okay, and now I can grab here and take that off, drop it, and now I'll give it a tug to make sure the balloon's in place, and it is. Okay, now the sterile part of my procedure is done because it's inside the body now. And now I'll take a alcohol wipe and wipe Heinz's thigh, and I'll put it close to his genital area so that he has some room for movement and it won't tug if he turns. So I wiped his body with the alcohol wipe, and I'm gonna stick the sticky pad on his quad right here with this facing down towards his quad, and then I'll unravel this, and this will clip. This would be on his leg, but there's no sticky ability anymore. And I'll stick this here. Boom, now it's stuck on his leg, and now I'll take this green clip and clip it on the bed. Clip it on the bed thing, the bed linen. And now I'll take this hook right here, this white hook, and I'd hook it on a non-movable object. So just pretend that it's inside of Heinz right now. And I'd hook it on a non-movable object on the bed frame. So I wouldn't hook it on a bed rail or anything like that. I'd hook it on like a bed frame that wouldn't move, so it wouldn't ever get tugged. Okay, and now I'd rip this off, and I would clean Heinz off if he needed to be cleaned. And I'd ask Heinz if there was anything else he needed before I go. And he tells me no, and this is not actually cooked on there. So I'm cleaning up my garbage. I clean Heinz, and I'm cleaning his bed area. And I tell Heinz, thank you. Is there anything else I can get for him before he goes? He tells me no. I remove gloves, wash my hands. Okay, now I got his bed locked, low position, side rails up ×2, a hand on his call light, bed alarms on if indicated. I'll remove the privacy curtain, wash my hands as I'm leaving, and then I document. Thank you.